Christian Adams, Senior Pastor of Hartford Memorial Baptist Church in Detroit, Michigan. And I'm very pleased to announce this launch of Hartford's Palliative Care video. As our congregants and community continue to age in higher numbers, we must be responsive to the onslaught of serious illness and the need for appropriate and timely care. There are many sick within our congregations and the Detroit community at large. So I am very pleased to introduce you to my special guest who will give us more insight about palliative care. We have the Reverend Diane Smith, Director of Ministry and Engagement for Angela Hospice, and Dr. Terry Mack, a medical doctor with the specialty in hospice and palliative care. Reverend Smith, let's begin with you. What is hospice care?
Hospice is a philosophy of care that assists patients with a life expectancy of 6 months or less if the disease process runs its normal course. Although many people equate hospice with giving up, the goal of hospice is to give a person the best possible quality of life physically, emotionally, and spiritually, and to provide support to the family. The focus is comfort care, not curative care.
Reverend Smith, what are the distinctions between palliative care and hospice care?
The goal of hospice care is to give a person the best possible quality of life and to provide support to the family. However, hospice care is appropriate when it is no longer possible to cure a serious illness, or when a patient chooses not to undergo curative measures. For example, when the patient does not want to experience negative symptoms from the treatment and so wants to have any negative symptoms managed for the time they have left. The illness is no longer responding to medical attempts to cure or to slow the disease's progress. Like hospice, palliative care provides comprehensive symptom relief as well as support for the family. However, palliative care is provided further upstream. While hospice care addresses symptom management near the end of life, palliative care can be performed in all disease stages, including chronic disease, and can be provided along with the care you receive from your primary doctor.
Thank you for those working definitions and that clarity. So tell us, what types of chronic diseases, Reverend Smith, are we talking about? Cancer, heart disease, asthma, COPD?
Yes, Reverend Adams, exactly. Additionally, you may receive palliative care while you pursue a cure of your illness. This is one of the major differences between hospice and palliative care. Of course, some people are cured while on palliative care, and they no longer need it, while others move in and out of palliative care as the needs require.
Well, let me ask this. Which medical professions provide palliative care?
Palliative care is multidiscipline care provision. Doctors, nurses, social workers all make up the team, with the nurse practitioner serving as an extension of the physician's role as director of care. Providers can also help family members to understand all your treatment options, again, including options for cure. As your needs change, palliative care providers can help you identify and achieve goals, such as making plans for end-of-life care and advance directives.
Where can someone receive palliative care and who pays for it?
Palliative care can be received in the hospital, at home, in a long-term care facility, or at a hospice. It's paid for by Medicare Part B, like a doctor's office visit, Medicaid, and some private insurance providers. More private insurance providers are covering palliative care because they realize that it prevents hospitalizations and saves money. In that way, it increases quality of life. Copays are billed to secondary insurance or families.
Dr. Mack, is palliative care only for the elderly adults, or is it also for the youth?
Reverend Adams, one of the wonderful things about palliative care is that there is no age limit. Consider children who have congenital anomalies, cancers, or distressing asthma symptoms. They could and do benefit from palliative care services.
Dr. Mack, when should a person seek palliative care? And what are the indices to look for and recognize?
In a proactive approach, the medical community should be referring patients to palliative care at the initial diagnosis of a chronic illness. As Reverend Smith said earlier, COPD, congestive heart failure, chronic kidney disease, diabetes, these are all lifelong and chronic illnesses if they follow their normal course. And we know that as these disease progresses, the symptoms can become more distressing. Involving palliative care early allows those symptoms to be monitored. Additionally, because it is a team approach, you form a bond and you form a relationship, and that's important for these lifelong illnesses. With respect to what are some of the indications or when is the right time to consider palliative care, one of the key questions you can ask yourself is, would I be surprised if this person were to die in the next 6 to 12 months? If the answer is no, you would not be surprised, that is a key indication that palliative care is necessary. Another opportunity is if there is an advanced illness, such as stage 3 cancer or stage 4 cancer. If someone has chronic kidney disease and they're talking about starting hemodialysis or they're already on dialysis. People with diabetes who have had amputations. Also, if there's any unmanaged symptom, any point of the disease, such as people with diabetes can get numbness or tingling in their hands or toes, that's also an indication to seek palliative care. Also, if someone has been hospitalized two or more times in the last 3 to 6 months for the same illness, palliative care would be indicated. Also, if someone is bedbound, whether it's at home or in a nursing home, and they begin to develop bed sores, I think the important takeaway is whenever you are aware that you or someone else you know or love is diagnosed or becomes aware of a serious illness.
My belief is that God has provided the medical means and the treatments to afford us a healthy life. We just have to claim them.
You are absolutely right, Reverend Adams. You know, the spiritual component of palliative care is actually found in the origin of the word. The Latin origin is palliare, to cloak. And when I hear my colleague talk about palliative care, she often reminds us of the story of the Good Samaritan. The Good Samaritan is riding along and he sees on the side of the road a man who's been hurt, who can't take care of himself, he can't pick himself up, and he stops. And he uses what he has at hand, water and a cloth. He wipes and washes the man's wounds, and then he uses his own cloak to comfort him and to get him to his transport, whatever that was, to take him to a safe harbor. And he pays at that point to make sure that the man is cared for until he comes back again, to check, to make sure that all is well. This kind of compassion and care and attention is what we offer in palliative care. And not just us, anyone who's offering that kind of care. The idea that you provide comfort, that you provide care, that you provide it upstream to make sure that everything is well, that meets the qualifications of the philosophy of palliative care. And that is a blessing.
Well said, Dr. Smith. I appreciate you and Dr. Mack for joining us today and providing insight about palliative care, this important medical specialty. Thank you very much for watching, and God bless you.